sexually transmitted infection. Today I want to talk about sexual transmitted infection. Sexual transmitted infection. That's what we'll be talking about today. Most people don't know what to call this. STIs. STIs. You migrate from infection to diseases. So when they tell you STIs and they tell you STD, they are two different things. Which means from infection you get disease, but you cannot get disease before infection. From infection you get disease, which means it'll tell you now that this person has gonorrhea, this person has staph, which is staphylococcus, or this person has fungal infection, this person has parasite infection. These are what we're talking about. So let's discuss. Let's know how we contact this what STIs. Let's know how we contact what STD. So many women are suffering from STIs and so many people are suffering from what STD. Sexually transmitted infection, or you can call it sexually transmitted disease, which is known as what STD, okay, as usually spread by having what vaginal or oral sex with what multiple partners, okay. So most, in a nutshell, is as in women are more likely to have it than men. Yes, if women are to be 100 or let's say 20 million, women on the higher side has what this infection or rather the diseases to men. None that men does not have it. That is why we see you have bacterial infections, you had fungal infections. They are so different. Don't allow anyone to deceive you. Like I always tell my people, or like if you want to treat infection is treated in two ways. What are the ways you can treat infection? You go for what? Lab check. Go for lab check. Allow the scientist or the lab technician to take a sample of you, whichever what the test you're checking, and it has time to proceed. It has time that to elapse. It has time for what you get your result. So when you get your result, if you are bacteria infected, it will tell you when and what to do. But if you are fungal infected, there are some ways you can what easily treat yourself. Okay, and note today that there are some infections that can be cured and there are some that cannot be cured, but there are drugs you can use as well to manage yourself. Yeah, like someone that has cancer, they will tell you they have to what remove that they have to remove when they check the person has to be on drug just to manage the person's health. Like same with someone that has HIV, they have to what manage this person. Okay, that is what we are talking about. There are some infections that you have that can be cured and there are some that cannot be cured. Know that today. There are some that can be cured, there are some that cannot what be cured. That is what I want us to know. That is one thing that we should know. Don't allow anyone to deceive you. And whenever they tell you this is the sickness you're having, don't take it to heart. Don't disturb yourself. Don't worry yourself. Because most people you hear today that they'll tell you this person slept and he did not wake up, let's use that because of restriction, is as a result of, not because of the sickness, but as a result of them hearing it, the way the word was being pronounced to them, the way they just announced it to them. No. When they tell you anything like that, what you should do first, fine, it is good to panic because why? You're dealing with life. Fine, but take the result. It is good for you to have someone that you can talk to, a medical personnel. Is either your GP or you have a gynecologist, whoever you know you can talk to as a physician that can help you check upon you, that can help you and tell you, okay, this thing has a remedy, or this thing, okay, this is what you should be doing this time, tomorrow, next tomorrow, or and so on and so forth. They should tell you those things that you'll be doing that can help you keep you. So not all infection that can break you down, not all infection that can that can be cured. Some can be cured while some cannot be cured. So today I want to tell us on that sexually transmitted infection. Okay, an STIs is an infection passes from one person to another. That is, which means sexual transmitted infection is an infection that is being passed from one person to another. Okay, passed from one person to another person through sexual contact, which means if you don't have sexual contact with someone, you cannot contact sexually transmitted infection. You can only contact STIs through sexual transmitted infection. Okay, because it is being passed from one person to another through what sexual contact. And an infection is when a bacteria or a virus or a parasite enters and grow. It enters you and it grows on your body. It enters you and it grows in our body. STIs are called sexually transmitted disease or sexually transmitted infection. When we say STD, which means sexual transmitted disease, then when we say STIs, we say what sexually what transmitted what infection. So you can see that from infection you migrate to what disease. From infection you migrate to disease, but you cannot get disease before infection. It is infection that grows and becomes what disease. Okay, so if you now ask me how or who gets these STIs, who are the people that can contact these STIs, okay, or what are the rates of people contacting these STIs? About nearly 20 million people, if not even more than 20 million people all over in the state and everywhere, okay, get STIs each year. So it is something that people get every year, because people you want to, the person you are making out, the person you're having intimacy with, you don't know what the person carries. Even you don't know if you have it. So when you have it and you contact it already, now you are sleeping with someone that has it as well, it will what flags and what starts reacting to your body. So if over 20 million people get what STIs every year, over 20 millions of people everywhere around the world, they get what 20 STIs every year. And this infection affects women. It affects women and men of all background. It does not have special people that you not say no, this person is special, that is why it's affecting this person. No, it does not have such special people that it can affect. The people it can affect are what the people who has it, not specially, basically, know what people who does not know. No, it does not has any special background. So it affects everybody, background or your economic level or whichever level you belong to, does not care. It affects what everyone. Okay, and also half of all new infections are among young people. Half, about maybe people about 15 to 24 years of age, they have infection as well, but these are what new infections. Okay, so that is what we should what know right now. This one is going to be like, who do STIs, as in how does STIs affect women? How does it affect women? If you want to ask, okay, you are talking about STIs, how does it affect women? Okay, which of these women, or women often have more serious health problem from STIs than men? That is just it. Women have what STIs problem than men. Women has what STIs than men. So why is this? We have the chlamydia and the gonorrhea. Okay, left untreated, raise the risk of what chronic pelvic pain. When someone tell you when you go for test, they tell you this thing is pelvic inflammatory. From there to start giving you pelvic pain. Pelvic is just something. Also, you can add anybody that they've told you this thing is chronic, just know that it is serious. Chronic pelvic pain and what life-threatening ectopic pregnancy. Yes, ectopic pregnancy has something to do with STIs. This is why women often have more serious health problem than men. Okay, so when it's been left untreated, it raises the risk of chronic pelvic pain. And when it have this pelvic pain and life threatening, it can lead to ectopic pregnancy. There was if you remember previously, I did a video on ectopic pregnancy, how the child is being formed outside the womb is not formed inside the womb. So a child that has been formed outside the womb is called ectopic pregnancy. What is supposed to be seen inside the inside the uterus and now see inside the fallopian tube. It is what we call what this ectopic what pregnancy. Ectopic pregnancy. So you leaving this infection untreated, staying inside of you for a very long time, it will cause a risk and life threatening that can as well what leads to what ectopic pregnancy. So now you see that most women who has ectopic pregnancy, they are what some infection that has been left untreated that has stayed there for a very long time. Because why? They don't know. Some ladies can be feeling itching. They will just think it is normal. Some will tell you maybe it's just because the clothes I washed, I just went to take it and I just wore it. That is why I'm having this itching. Unknowing to them that there are some infections that you need to treat, not because of that pelvic, undies or the pants you're wearing, because maybe where you hang it. No, it is because you are infected already. That is why it is advisable that undies are supposed to receive direct sunlight. So that is the direct sunlight will help you what bring out or kill some germs. It's supposed to receive direct sunlight, not you washing your undies and you keep it inside your room, the room temperature to dry it. No, in such way you are inviting what infections to yourself. So now you can see that when you leave some infections, gonorrhea, chlamydians inside of you, and it has been untreated, and now it is a life-threatening one, it can as well what lead to what ectopic what pregnancy. And chlamydia and gonorrhea also can cause what infertility. Yes, it can cause infertility, that you were not able to give birth, to get pregnant, or the man was not able to the man was not able to procreate. It's not it could not ejaculate very well. This can as well what cause those things. Okay, gonorrhea can cause what infertility. Infertility does not really do with only women. Infertility is something of both man and a woman. That is where infertility comes from. Okay, so that is why, if you remember, there was a class I did before. I talked about what the analysis of sperm, the number of sperm that you need to have before they can tell you can what procreate. There's another word, oligospermia, where they'll tell you, oh, you cannot what procreate. But people with oligospermia, they still have chances of getting what a woman pregnant if the woman's gene is higher than the man's gene. Yes, it can get pregnant. Okay, so even when they tell you your sperm analysis is low, you cannot procreate, there is always a remedy. What are these remedies? Take your results down to your doctor. Take your result to your physician. Let the person tell you what to do. And when they tell you what to do it the same way they've asked you to do it. Before you know, things will get better. But people will always consider the amount they have in their pocket. People will always consider what they have for when they know they are dealing with their lives. So today now you're hearing now that chlamydia and gonorrhea can as well cause you infertility. It can cause you infertility, and also you having untreated and life-threatening infection can as well cause you ectopic pregnancy. When the baby is not being formed inside the womb, the baby is being formed outside the womb. It will not stay, because the womb is designed and created already for that baby to live in. But when you have infection and the baby could not stay inside the womb and form outside the womb, it will not stay. And it always has chance to stay. The only chance it has is the first week to 16 weeks, and after then the baby will go. So there's nothing like God will do that. Let me just keep it and keep praying. No, just take it out, because the baby cannot stay outside the womb. Okay, so that is it. So untreated syphilis in pregnancy, women result in in infant death. When you have untreated syphilis, I did this topic before about syphilis. Syphilis is something that we need to treat. When they tell you have syphilis, treat it. Go and treat it. Syphilis, untreated syphilis in pregnant women results in infant death. Okay, up to about some percentage of the time of people, many women has lost their child, they have lost their baby in the process of having untreated syphilis. They have it. So untreated syphilis can as well affect a pregnant woman in having stillbirth, in having a process infant death. Okay, so let's try and take care of ourselves. Women have a higher risk than men. Women have a higher risk than men of getting an STIs during unprotected vaginal sex. Yes, we have it because why? The man is just, our bodies are very open. It is what they give you that your body take. Okay, even if the man has to sip from you, you will take first before he has to sip from you. So whatever they give to us is what we take. So women has a higher risk of what? Getting what? STIs during what? Unprotected what? Sexual or vaginal what? Sex. So unprotected anal sex put women at even more risk. Those women who open their anus for men to penetrate, they have what? More higher risk, okay, getting STIs than what? Unprotected what? Vaginal sex. So for those of you doing anus whatever, anal sex, just know that you are more at risk of getting STIs than the women using what? The vagina for what? Unprotected what? Sex. So STIs spread in different ways, okay? STIs spread in different ways. I'm just trying to break this thing down for us to understand. I've told you people, the way women contact it, why they are at risk, I've told you already. So now I want to tell you the way it spread. The following ways this STI is spread from one organ to the other, or the way it travels from one place to another. It is what I want to explain now, okay? I want to break it down for us to understand. In case maybe tomorrow they tell you these things, you can easily go back to the video, play it, sit down. Most times what you do is you don't skip things. This kind of teaching cannot just come all the time, but when you have opportunity, sit down and learn. Because why? Our life is something that we deal with every day. It is not something that maybe today you just take care of yourself, tomorrow you don't. That is why you always take your bath morning, evening possible, morning, afternoon, evening. So it is, life is what we deal with every day. So therefore, take care of yourself. Always look for what will make you what? Feel good and okay. Except that sickness or whatever you're going through, it is not something being physical, it is spiritual, and you want to use God's way. But aside you using God's way and you know it is something that you're really facing, why not sit back, relax, whatever that will distract you, take it out and focus, so you understand what we were talking about. Okay, so now, how does this infection spread from one body to another? It spread was having unprotected or without condom. You having unprotected sex without condom, okay? Vaginal, oral, or anal sex with someone who has an STIs. So you having sex with someone that has STIs through your vagina, the oral sex, or the anal sex, it can what? It can be difficult to tell if someone has an STIs. Yes, it is difficult to tell. STIs can be what? Even spread if there are no signs or symptoms. It can spread, and it cannot tell you that this one na STIs. Just know your body, know the type of body that you have. When you are irritated, you know what you have. Okay, irritation comes sometimes. You feel irritated, you feel weak. You can just be feeling weak, and it can be that maybe there's something that has entered your blood that was not supposed to enter your blood, and to start affecting you. Okay, so during genital touching, it is possible to get some STIs. Genital touching, we know what we mean by what genital touching. Touching some special parts in your body can what, and it is possible for you to get what? STIs, such as syphilis and herpes without having sex. Because you know why? I did a topic before. I love this topic today. I did a topic before, and the topic has to do with things you should do before and after sex, which means that the staying hydrated, washing of your hands properly, and after sex, taking water so you remove some fluid out of you. I did this topic before, so now this is what I'm still telling you again, that during genital touching, it is possible to get STIs, such as the syphilis and the herpes, without even sex. So for those of you that after touching the woman and everything, at the end of the day you forgot, you did not even wash your hand, you did not even take care of yourself, you just take the hand, you start biting your finger. For those of you, maybe you're the type that always string your finger, from there you've contacted something. That is the horror we are talking about. You've contacted with something. So through anal sex or through sexual contact, okay, between women who have sex only with other women, yes, women body, like I said before, is very open. When you open your body, another woman is touching you or whatever. I don't know how they are doing it as a less. So when these two legs are not meeting each other, they can contact as well. So don't say, how come did I contact STIs? I'm not sleeping with a man, so I'm just with my fellow woman. How come? Yes, you can contact, because why? You've touched something. Maybe your tongue orally has stopped something, so you can contact what STIs. So from a pregnant or breastfeeding woman to her baby, for a pregnant or breastfeeding woman to her baby, please, mothers, please take care of yourself, because from pregnancy you can contact it to your child, and from breastfeeding you can as well contact it to your child. That is why I said something before when I said syphilis, hepatitis can be transferred from mother to child during pregnancy. Now you hear that even STIs can be transferred as a pregnant mother or from breastfeeding to their baby. Okay, so now we understand this. Now we understand this. Someone asked, he said, can STIs cause health problem? Wow, this is interesting. This particular one is interesting. Can STIs cause what problem? Cause health problem. If STIs can cause health problem, yes, it can cause. Okay, yes, it can. It's just same way that somebody was asking the other day if sugar can reduce the sperm. Yes, it can. You should know those things can. STIs can cause health problem. How can these STIs cause you health problem? Each STIs cause different health problem. Different health problem. For women, certain types of untreated STIs can cause or lead to different problem. Can lead to so many severe problem. Okay, problem getting pregnant or permanent infertility. Problem getting pregnant or what? Permanent infertility. Problem getting pregnant or permanent infertility. Okay, you can see now that STIs can cause a big problem in our lives. Getting pregnant or permanent infertility. Okay, so these are what one of the problem. And organ damage, it can cause what? Organ damage to your body. It can cause you what? Organ damage. And it can also what? Certain types of cancer, such as cervical cancer. We know what is called cervical cancer. Cervical cancer. Okay, so treat yourself very well. Women, take care of yourself very, 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 very well. Cervical cancer, when you have untreated infection, you have infection and you think, let me just be eating, and you're not taking care of yourself. Through this process, you can have what? Cervical what? Cancer. And also we have what? Death. We have death. When it's too much in the body, it can lead to what? Death. It can cause you what? Death. Okay, so, and also we have what? Problem getting pregnant. Yes, like I said before, problem during pregnancy and health problem of the unborn baby. Yes, you see some babies now, they put to bed, they'll tell you this baby has jaundice, this baby has so and so failure, this baby has difficulty in breathing. Yes, during pregnancy those things were contacted, and because it was not treated properly, it now affects the child. It now affects the child. Autism will start from there. So these are the reason why you can see that STIs can cause you a big what? Health problem. Don't look at the name that is just STIs, sexual transmitted infection. It is something more than that. It is something more than that. STIs is something more than that. Okay, so it is something more than that. So what now are the symptoms of what STIs? If you ask me now, what are the symptoms of STIs? Many STIs has mild symptoms, okay, or no symptoms, which means sometimes you can have symptoms, sometimes you might not have symptoms. So not all STIs comes with symptoms. Some comes with symptoms, while some you don't have what the symptoms. Okay, so when women have symptoms, okay, they may be mistaken for what? Something else. When women have symptoms, they may be mistaken it for something else. Let's say, for example, maybe you're having these stomach cramps, abdominal cramps, and you just feel it is your normal flow. You have menstrual flow. Maybe that is the reason why, or your ovulation. That is why you're having what? These cramps. I tell you, it is not. Sometimes those things can be because of the infection you have already. It can be the sign telling you have infection. It can just be a symptom telling you have what? Untreated what? Infection. Okay, so such as urinary tract infection, we have urinary tract infection, we have the yeast infection. The yeast infection is, the urinary tract infection is when you try to pee and you have sharp pain. You start having pain, the sensation is too much, the pain is too much. Okay, so with yeast infection is the discharge you bring, the discharge. Like I told you before that we have different type of discharge, but when it's infected, the colors change. So when the color change, looks like the yolk of egg. So this process, you having this discharge, is what we call what? Yeast infection. Yeast infection. So yeast infection is also what? One of the sign of you having what? It's also a sign of what? STI what? S. Please, if you are joining me, please can you help me to share out and send reactions? Thank you. I can't see. It's not showing that people are here because of, I don't know, maybe network issues. So yeast infections or yeast infection or urinary tract infection, and yeast what? Infection. Okay, yeast infection and what? Urinary what? Tract infection. All right, so we have what? Your advice for this infection, if you ask me what you should do, I will tell you, each time you feel this hot smell, you feel different discharge coming out of you, you see this discharge coming out of you, okay, you feel this discharge inside of you, and anytime you want to wash yourself, you see hot smell. It's different from the kind of smell you usually see. Please check yourself, take a treatment. Okay, get treated. It is better you get treated on time to avoid mistakes, to avoid what? Infertility, to avoid what? Because you know that there are some infections that you have, something like this STIs. When having this certain type of STIs, it makes it as in more easier for you to have HIV. Yes, that is why when they tell you that, they tell you this person has HIV, what leads to this HIV, they cannot tell you. That okay, gonorrhea means with yeast infection, means with urinary tract infection, means with syphilis, means with that this one is what produces HIV. Nobody will tell you, but they can only tell you when you have untreated long-term infection or some certain type of STIs, some certain type of infection inside of you can lead you to what? HIV. Okay, so it comes in contact with it. STIs comes in contact with what? Those things. So please get treated and what? Know the right way to treat, because when you know what you know is what you can cure. What you then know, you'll be assuming. So instead of you to assume, why not go test yourself, get tested and what's treated? Treat in the right procedure. If you are couples, treat same, treat together. Don't treat separately like I'm busy, my wife, you go and treat first. When you treat, I will treat. No, Couples treat together. When it comes to infection, you don't treat differently. As long as you are spouse, you guys are couples. As long as you are doing that thing together, treat together. Because if you treat differently, it will come again. The process of treating infection is different from the process of treating malaria. Because infection is something of, if you want treat after the other, it will come back again. Because the time you're supposed to, when you treat together, there are some things you need to follow. Which are those things? You treating and I'm treating the same time, we don't meet. Yes, treating together, you don't meet each other. And during that process, even if they tell you condom, you cannot use it, because the lubricant used in making it is oily, right? So you don't even know. Those things can easily cause you what? Infection as well. So you don't treat together. What you should do is this: during this treatment, stay. After your treatment, you are staying for another 1 week. After 1 week, it is when you can now start making out. Because why? As at that time, the drugs, everything you must have taken has worked. So spouse, boyfriend or girlfriend, as long as you know you have someone you are doing that thing with already, if you want to treat infection, treat together. Don't treat separately. That is just a person to tell you, I treated though, I did this, but it's still not going, I'm still feeling this itchy. Ask yourself this question: did you treat with your spouse? And when you treat, did you go back and do that thing that you're not supposed to do while treating? So these are one of the things that makes those sickness, they can't go permanently. They can only go and come back. Not that this infection will just go permanently and you don't see it again. No, that is not what I'm saying. What I'm saying, but if you do it in the right way, instead of you treating every 3 months or you treating every 2 weeks, you see that in the next 6 months you will live your life. You will not treat until, because most times it's not really about that. At least maybe the toilet you now get to use, the place you pee, the way you hang your clothes and all that can also what cause you what's this infection. Okay, so a question that someone asked: how do you get tested for what? These STIs. How do I get tested for what? STIs. How do I get tested for what? Sexual transmitted infection. The thing is, like I said before, if it is a doctor that is telling you that you have infection, the doctor will give you a note on the type of test you should go for. And when you get to the lab, present the notes to them, and they know what to do. And they'll tell you when to go for the result. It is not a thing that you do today, instantly you get a result. No. They'll tell you, so and so time, call for the result. So through the result, you know what you have and what you're treating and how to treat it and the procedure you need to take. Okay? STIs can include like pelvic and physical things. Okay, your doctor or whoever that is being assigned to you of the infection, such as the warts, the rashes, or discharge, blood tests, they know what to do. Okay, so I will not start explaining on the process how you can take this, treatment. I will not explain it. Okay, if you message me on my inbox, I'll tell you the type of infection test that you need to do. If you are experiencing anything, just drop a message on my comment section, or message me on my messenger, and I will reply you. I don't scum messages. I reply, except the message does not really count. So but as long as the message counts and it has to do with life, people knows me very well. I reply messages because earth is wet. Earth is something that we all need to deal with. Okay, so I will definitely reply you. Okay, so that is it. I will have to stop here for now because I don't want to so I can continue this topic some other time. So I'll stop here for today. So now we understand this STIs, we understand this infection, we understand how it's treated, we understand how we are supposed to treat ourselves. Okay, STIs, don't joke with it. STIs, don't play with it. Now you know that when you have STIs long untreated, it is life-threatening. It is life-threatening, and when it's life-threatening, it can lead to ectopic pregnancy, and it can lead to infertility or permanent infertility, like you not be able to get pregnant or permanent infertility. Now you understand those things, not the normal or the usual way they tell you STIs, you just get infection. No, it is different. Please, let's treat ourselves, let's take care of ourselves, let's take care of our body and know the right thing what to do. All right guys, see you next time on my life. See you next on our video. What will come back again and do more on what STIs and what STD. Bye. Take care.